Good afternoon, good morning, good evening, depending from where you are joining this call from. Welcome, karibu sana to the first webinar for the year, organized by Kenya for Resilience Community of Practice. We are excited to bring to you this wonderful, exciting conversation on the role of mental health in building resilient communities. So we welcome you to this webinar. Feel free to interact, to send in your questions, and just to be part of the conversations. So my name is Pauline Madiro. I am the Kenya for Resilience Community of Practice Coordinator. I am not the moderator for the day, but I will just take you through the introduction of Kenya for Resilience, what we do and what we engage in, and then I will hand it over to the moderator of the day. So our goal as Kenya for Resilience is building resilient communities in line with the Sendai framework. And when you talk about resilience, we talk about resilience as being about the people and their strengths. Next, please. Thank you. Next. So the webinar is being recorded, and these are the platforms where you can find us. We are on Facebook, on Twitter, and on Instagram. Kindly follow us just to get information of all the things we do, and just to learn and be part of the journey as we sharpen our skills towards building resilient communities. Next. So there is a link that we will send on your chat box. You could join the Kenya for Resilience Community of Practice platform. And when you click that link, this is the picture you'll find there. And this is the background. So you'll be able to just be part of us, know about us, get good enriching materials through the learning hubs. And that is where we share all the information when it comes to Kenya for Resilience. So you will also be able to get a contact that you could use just to reach out in case of any questions. Next. So these are some of the partners that we are working with, but we are over 30 partners. And just to take you back, the conversation about Kenya for Resilience Community of Practice started way back in 2019. And these are some of the partners that were there, and they thought about creating a platform for member organizations who are implementing resilience models. And there are about over 30 organizations, and this is just a representation of some of the organizations. Next. So as I told you, Kenya for Resilience, we have two approaches, that is the community of practice and the consortium. So the community of practice is a network and a platform where we share and we learn various approaches when it comes to resilience implementation in our programming. And through the community of practice, we were able to come up with the consortium. So the consortium is the implementing arm. And we have this project in Tana River, headed by International Aid Services, and we have Samburu, and our lead partner there is the Salvation Army. So these are some of the good things coming out from Kenya for Resilience Community of Practice, and we are looking forward to having more consortiums and having Kenya for Resilience as the voice of the civil society organization, the final voice in Kenya, and expanding our territories to Africa, the final voice of the final voice when it comes to civil society organizations, when it comes to matters of resilience. So the COP seeks to strengthen the collaboration and networking amongst its members. And some of the things we do here are we hold annual exposure visits just to expose our members to various places around Kenya so that they can be able to learn from other organizations and other projects on how they are implementing resilience. So this is a link, and you once shared in the chat box, you'll be able to click it and learn more about Kenya for Resilience. Next. So we will be sharing our attendance form in the chat box. Kindly feel free to fill in your information for future engagements. And it will really, really be nice for us to know you as you also know about us. Next. So I will introduce our moderator for the day. Kindly meet Shivangi Chavda. She is the Senior Regional Lead Asia and Europe with the Global Network of Civil Society for Disaster Reduction. She has spent almost 20 years giving contributions in the humanitarian disaster risk reduction, climate change adaptation space across Asia. And she's the senior lead at GNDR, responsible for membership engagement, networking, capacity building, and leading the global projects. She manages the GNDR flagship project that is on the Views from the Frontline 2019 across 50 countries in the continent, and her portfolio includes action-based research work, program implementation, networking, fundraising, and advocacy. So kindly welcome Shivangi as she takes it up, and we are ready now to listen from her as she takes it over. Karibu sana. Over to you, Shivangi.
Yeah, thank you, Pauline, for your generous introduction. Good morning, good afternoon, good evening, everybody. It's a pleasure to be part of this important and most relevant webinar titled The Role of Mental Health in Building Resilient Communities. Just to go through the agenda for today's webinar, we just heard Pauline giving the introduction, and then we have presentation by our two esteemed speakers, followed by question and answer sessions, speakers concluding remarks, feedback, and closing. To touch upon the subject before going in depth and today, as World Health Organization defines mental health as a state of well-being in which an individual realizes his or her own potential, realizes his or her abilities, can cope up with normal stresses of life, can work productively, and is able to make a contribution to his or her community. Having sense of a positive well-being enables person to approach other people and situations with confidence and optimism, which is often shattered due to situations such as wars, conflicts, impacts of climate change, such as ongoing droughts, etc., which also impacts the lives and livelihoods of the people most at risk. But people with a positive and confident mindset, therefore, contribute to building resilient communities. So today, through this webinar, we will be able to understand further how mental health plays a vital role in building resilient communities. Before I introduce you to the speakers, just few housekeeping rules. If you have any questions, please post it in the chat. Please keep your microphone muted when speakers are speaking. You can raise your hand during the time when you want to intervene after the speakers have spoken. Also, please, the question of the day today is that how will your organization implement learning from this webinar? And you can write your comments on the chat during the session. With this, I'm very happy to introduce our first speaker of the day, Mr. Mike Vaneju. I'm sorry for my pronunciation. He's the program coordinator at TINADA Youth Organization, which is a community-based organization. He's a human rights advocate, passionate about environment, health, and well-being of persons with disabilities, with a very keen focus on mental health and psychological disabilities. He's a professional with over 5 years of experience in mental health, psychosocial and addiction counseling. He spearheads efforts to advocate for better systems for mental health in Kisumu County. Mike is ambitious kind, self-driven, and a go-getter, which are some of his traits. So without keeping you awaited from the speaker, let me stop sharing my screen at this point, and I invite Mike. Mike, you have 20 minutes to share your perspective on the topic. Thank you.
Thank you very much, Shivangi. Thank you for the nice introduction. And so I think I will go straight into my presentation so that we don't really waste a lot of time. So today we are going to be looking at the role of mental health in building resilient communities. And as we are two speakers, I will be more of painting the context of mental health in resilience. And the next speaker will give you practical examples in terms of what has worked in terms of building the resilience, especially around mental health for the community. So I'll just introduce my organization. As I was mentioned, my organization is TINADA Youth Organization, which is a CBO, which was registered in 2001, and then later as a youth group, and then in 2014 as a community-based organization. And then we are a family-driven integrated initiative, which we employ the family to family, looking at the family as the smallest unit, whereby we need to start from to drive change, and also looking at a youth-to-youth kind of interventions, which focus a peer approach, actually, to be able to drive and realize our vision, which is an empowered, healthy, and just society. And our mission is to promote delivery of inclusive integrated health services, information, rights, and strategic community empowerment and partnership with special attention to children, youth, young women, and persons with disabilities. So that's just in a nutshell about another youth organization. Of course, you can find us in the social media if you want to know more about us also. And so going straight into it is the first question that just comes into mind is, what is mental health? I know most of us, we have been defining mental health, and immediately we hear the term mental health, we just think about that person in the street who maybe is not wearing decently, or has torn clothes, or is speaking to themselves and maybe collecting garbage here and there. And we think that that is what mental health is. But I think today we are going to look at it and just maybe understand what mental health is. So mental health relates especially to how we think, feel, behave, and interact with other people and our environment. So mental health is the whole spectrum, not just looking at one side of the spectrum, but the whole spectrum of how we think, how we feel, how we behave, and how we interact with other people, and how we interact also with our environment. And so going to the WHO definition, it is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to contribute to his or her own community. And I would just like to point out that even in the definition of mental health, we already have the aspect of resilience. So these two concepts are not really that far apart, but they're actually intertwined, because when you say that can cope with the normal stresses of life, that in itself, we're already speaking about resilience. And so the two concepts are really much intertwined and related. And so we go to the next aspect and ask ourselves, what is resilience? And so in terms of resilience, then, resilience is the capacity of people to confront and cope with life's challenges and to recover from or adapt to adversity. So basically, resilience is your ability to move on despite something, a traumatic or a tragic event that happens, but you're able to cope with it, or a disaster, you're able to cope with it and move forward with your life and continue to live, and even adapt to the new circumstances of that have been brought about by the disaster. And speaking of this, one of what comes to mind for all of us is especially the coronavirus period, whereby we have had that epidemic, and so, or the pandemic, sorry. And so after having that as a pandemic, then we were able to cope, and we wore masks, we had to social distance, some of us had to work from home, others we had even to reduce the capacity of maybe of even change how we travel, in terms of traveling with matatus, and maybe go to more motorbikes and so on. So we were adapting to adversity, and in that sense, we were being resilient and coping with the disaster that has happened. And if you remember correctly, one of the things that was actually exacerbated by the coronavirus was actually the mental health aspect of the community or of the country or of the world in general. And so we speak about mental health and resilient communities. So mental health is central to achieving the SDGs, SDGs with Sustainable Development Goals. And in this, we find that most of the SDGs, actually, you will see that an element of mental health really comes into place. Of course, speaking about SDG 3, which is already about health, then we know that that directly also just speaks toward the aspect of mental health. And so mental health is intersectional, which is both affected by and compounds other social determinants of health and well-being. That in itself, mental health, one, can be affected by other social determinants of health and well-being, and in itself can even compound the other social determinants of well-being. So, so that is just trying to understand the relation between mental health and our environment and other social determinants. And then mental illness is a cause and a consequence of poverty. So it is both a cause and a consequence of poverty. Persons who have mental illness now are also very much prone to live in poverty, and also persons who are in poverty already are very much prone to having mental illnesses. And so we continue, and now we look at disasters, and disasters are known to have substantial effect, especially on the physical. And I think more often than not, we really focus on the physical or what is seen, and we always forget about the mental health aspect of the population, which is also affected during these disasters. Because as much as I'm affected physically, then I carry that traumatic event in my head and replay it over and over again, and just thinking about what I would have done differently. And that in itself takes a toll on one's mental health. And then along the social and economic losses, the individuals and community experience a mental instability, which might precipitate mental health conditions like post-traumatic stress disorder and anxiety and depression in the population. And I think most of us, if you've been able to study the trend, especially after the COVID-19 pandemic, and for the countries that maybe have been affected by conflict, if you study the period after the conflict, you realize that the scars that are physical actually heal, but the scars that are more not seen, not physical, are more of not really showing, but they are not being attended to. So in that sense, they don't really heal in time for the person to be able to actually adapt to the new situation. And so some of the conditions are like PTSD, which is a post-traumatic stress disorder. Being exposed to a traumatic event, then having that scar in your mind or in your brain, then it comes about and it plays a role in terms of bringing out the PTSD. There's also elements of anxiety and depression in the population, looking at the losses that one has gone through, and how looking at moving forward in terms of life, how do they go from where do they go from where they are at the moment? So that also brings about anxiety and also some elements of depression. And then we also look that the occurrence of these mental health conditions themselves will inhibit the resilience of the community. And in the sense that when someone is already affected by a mental health condition, then their resilience is already challenged, because someone who has anxiety, has an anxiety attack or an anxiety condition, then that person cannot really be able to cope with the normal stresses of life, because any stress, any of the normal stresses of life then will be able to exacerbate the symptoms of that anxiety condition that the person really has. And disaster not only disrupts the quality of life, but it also creates a significant burden of mental health conditions on an individual and the community. So when the disaster happens, it does not only affect the quality of life, but it also brings about a toll in terms of the mental health, in terms of bringing about mental health conditions to an individual and also to the community, because if one person in the community is affected, then all of us are affected. And one person in the family is affected by a mental health condition, then we are all really affected by that mental health condition. So looking at effective mental health interventions, then they should be given a pre, peri, and post-disaster period to improve the adverse mental health effects of the disaster. And this is looking at one, the pre is just about building the resilience, that is building the resilience of the community and of the persons in the community to be able to cope, especially with the disasters if they do happen. that is just being prepared for the disasters. And then again, you find that we come about to the point of whereby resilience actually can be worn out. You can be very resilient at the moment, but after undergoing through a disaster or a period of trauma, then you find that your resilience will wear out, and that's why we bring about the aspect of the disaster period. That is, during the disaster, there's also need to have mental health interventions in place, be able to support the community, and also post-disaster, that is after the disaster, you find that there is also need to continue to offer mental health interventions, because the physical scars will heal, as I mentioned earlier, but the ones that are more psychological then will take a little bit longer to heal, because most people do not really even speak about them or come out and seek help for them, but they maybe prefer to just try and what we call try and man up, or try to deal with them in a way that is not really kind of healthy, or coming out to seek help. And so when where the community is then empowered to cope with resilience with future disasters, when we have this intervention in place, that is the pre, peri, and post-disaster period in mental health interventions. When we put this in place, then the community is better empowered to be able to cope. That is the aspect of resilience with future disasters. And in that way, we are actually contributing towards building more resilient communities, because the health of the community, and that is specifically their mental health, is also catered for, because that is where the biggest scars always remain. And so looking at what can we do as individuals in terms of supporting ourselves to be able to deal with these mental health conditions, in terms of mental health conditions, or mental health and building resilience, then to build our resilience, especially in terms of our mental health, we will need, number one, for the self to do is what we need to do is exercise often. That is have a lot of exercise. Then the other is to eat a balanced diet, and in bracket, that is eating enough. A balanced diet does not really mean that you eat too much or too little, just eating enough and making sure that all the food categories are being consumed in the right amounts. And then there's the aspect of getting enough rest, and then avoiding and or reducing drug and substance use, which is very critical, especially in terms of mental health, because this in itself can exacerbate or amplify the mental health conditions that one might be prone to. And then there's the aspect of even taking a break. Taking a break is good sometimes. When you feel overwhelmed, when you feel like you're getting to a point of being burnt out, then you really need to take a pause and take a break and just relax, so that you can be able to take care of your mental health. And then the other aspect is also we need to talk about our feelings. We need to talk about our feelings and share about what we feel, because in sharing how we feel and what we are feeling, that is the only way we can be able to get help to get help. And then the other one is just to seek help when you feel overwhelmed. Sometimes we are normally tempted to try and cope on our own, but sometimes we find that it is really not about ourselves, but it's about coming out and being strong in terms of coming out with the problem and just saying that I'm feeling overwhelmed and I actually do need help. And then looking at what we can do for the community, then number one, I think we need to demystify and educate the community on mental health, because we find that mental health is still clouded or shrouded in a lot of stigma and myths and misconceptions also, which bring about the stigma. So we need to demystify these myths and misconceptions so that we can bring out the correct picture of mental health in our community, so that you can be able to address it. And then there is need for sensitization and creation of awareness on mental health, and especially where to get mental health care services. If you ask most people in the population where they can get help for malaria, they will point to their nearest hospital. But when you ask them, when you feel overwhelmed or if you feel when they feel that they have a mental health condition, where can they go? Then you find that this person rarely know where to go to get mental health care services. So there is need to create awareness on the points of care that actually offer mental health care services, so that you can be able to help the community when they feel overwhelmed, to be able to get this help. The other one is also to encourage help-seeking behavior. And this is very important, because most of the time persons feel overwhelmed, and they use the term that they are introverts or something of the sort. So they're not really going to speak about their problems, but it is really about sometimes seeking help when you feel overwhelmed, which is very important. so that you also protect your mental health and also continue to build your resilience, because building a resilience requires social capital. That is the people around you who can be able to support you. And so there is need to be able to have help-seeking behavior. And the other one is encourage health-seeking behavior. Now, this is the aspect that most persons, especially who maybe face mental health conditions, will not really come out to go and seek help at the nearest health facility. But you find that there is need to go to a health professional who can be able to give you help in terms of your mental health and the mental health condition that you're actually suffering from, so that you can be able to recover from it and also live a healthy life, and be able also to cope with the normal stresses of life as it is enshrined in the definition of mental health. And then also just to wind up as continuing with what we need to do for the community, we also need to advocate for mental health to be a core part of any public health strategy. That is even more pressing, especially in a time of recession, austerity, and economic uncertainty. In these uncertain times when we are seeing pandemics coming out, we are seeing wars coming up, and we are seeing other issues like the high cost of living that we are also already experiencing, then we need to advocate for mental health to be a core part of the public health strategy, which the public health strategy is basically trying to reach, trying to provide health at the simplest unit, that is the core unit, that is the community unit, or at the family level. Families being empowered in terms of understanding what health is, what their health is. And in this, then if we integrate mental health, then we'll have given our community a fighting chance and build the resilience of our community in terms of dealing with mental health conditions when they occur, and even in terms of recovering from disasters when they do occur, because they will have an understanding of their mental health and have built some social capital to be able to overcome the tough times that may come their way. And so on that note, I say thank you. And that was my short presentation. I hope you have been able to learn something from it, and looking forward to maybe answering the questions during a question and answer session. At the moment, I would like to return it over back to Shivangi. Take it over from there. Thank you very much.
Thank you, Mike, for sharing this wonderful presentation, presenting the inherent linkages between the resilience and mental health, as well as the intersectionality that you mentioned is very important. I think also the cause and consequences that you mentioned, that how mental health can be a cause and then it can lead to consequences, especially in the spectrum of resilience while we talk, and also that how we can cope up as a community, as an individual, as a member of CSO organization. So thank you for that. I would also take this opportunity to thank Mr. Jacob Auma to really let us know how they are going to use this webinar, and he has stated that Arise Disabled Person Self-Help Group will use the knowledge acquired from this forum to create awareness on mental health to the people in our community. Thank you so much, Mr. Jacob, and we encourage everybody to kind of really state how you are going to use the learnings from this webinar. A gentle reminder also before we move forward, please fill in the attendance form. Please also fill in the evaluation which is presented in the chat box, and do ask questions. This is the good moment to ask questions. We do not have this kind of webinars with this kind of complex topics, so it is an opportunity for all of us to ask questions. So without further delay, let me just introduce our second speaker. I hope you all are able to see my screen. And I'm very happy to call in now Mr. Basilio Mwangi. He works with IFRC, International Federation of Red Cross and Red Crescent Societies. He supports 14 countries in Africa region in matters of mental health and psychosocial support, MHPSS. His portfolio covers mitigation, response, prevention, recovery, and resilience building, positive coping mechanisms in mental health and psychosocial support for people in distress caused by natural or man-made factors. Over to you, Mr. Basilio. You would have 10-20 minutes to present yourself, and then I shall stop sharing the screen. Thank you.
Thank you so much, Shivangi. Let me put my screen on. So good morning, afternoon, evening, salam alaikum, hamjambo, and all those greetings. I can see so many countries. We have Netherlands, Tanzania, India, Sweden, Zambia, Nigeria, and many others. So we are happy to have you all here. Yeah, to discuss this pertinent issue that we share in common despite, yeah.
Kata hivi na makasi screen. Alafu sana.
Great. So Mike has alluded to what we are discussing today. Thank you, Mike, for that. And he has actually told us what we can do and some of the ideas of how we can apply MHPSS or mental health and psychosocial support in building resilience in our areas of residence or in our communities. Now, I want us to go into details and see what have we done, whether as a person or as organization. And my examples will more or less dwell on what the Federation or the IFRC have done in terms of linking mental health in building resilience of the community. This opening picture, as you can see, is a picture taken in Palestine. And this is their Red Crescent. We call it Red Crescent because it's an Islamic country. And the whole idea here, this intervention was to build the capacity, build the resilience of these particular young ladies and young girls, as you can see. So by that, I'm also trying to introduce my organization, the International Federation of the Red Cross and Red Crescent Societies. We work in all the countries and our main role is to mitigate, to respond, and to build recovery of the affected populations due to disasters or any other crisis that they may be going through. So for me, I'll not look at how we respond to floods, but I'll look at how do we make sure that the affected population is okay psychologically to be able to soldier on or to create a normal situation from whatever had affected them. And that is something that Mike brought out quite well. And for me to do that, I will define some of these terms. Not sure if you can, you're still able to see my screen?
Yes.
Good.
We are able to see that. Yeah.
Perfect.
Yeah, that's fine. Yeah.
All right. So I just want to build up on Mike's definition of resilience, and it's the ability to bounce back after something difficult has happened or to get through difficult experiences in a positive way. So there are so many ways you can bounce back from a situation. Probably you got an accident or it's a divorce or whichever situation you're going through. But the way you bounce back to the normal situation or the normal way of life really matters. And that's why you need positive coping mechanisms. And when we say coping mechanisms, what do we mean? Is the ability to deal with challenges and difficult situations. Then after you build resilience, which we defined earlier, through these positive coping mechanisms, you restore to your social cohesion. You know, as a community, for us to live well, you need networks, you need structures. So if I'm not okay psychologically, then definitely I'm actually a liability to that particular community. However, we are human, we go through so many challenges. So we have to make sure that we have coping mechanisms that will help us support this community to build the resilience. But again, humans are prone to feelings and emotions. So you have to be psychologically fit for you to be able to be useful in whichever community you are in. So briefly, when we say psychological state of mind, we mean feelings. How do you feel because of a certain crisis? How do you feel because of a certain disaster? Which emotions are you bringing out because of what is affecting you? What thoughts are in your mind? What beliefs do you have? Do you believe in yourself? Do you believe that whatever happened is caused by something or someone? What are your perceptions and what is your behavior towards fighting whatever you're going through? Then when you go to social or cultural aspect, the traditions, the values, the upbringing, the relationships, family, community, they actually affect you in terms of how you deal with various situations in your perspective. So having that in mind, then let's take an example of a difficult situation. Like if we look at Kenya, we have the post-election violence. If we look at Sudan, I hope Sudan is represented here as well. We have the uprising that we are going through currently. If you jump over to Europe, you know what is happening in Ukraine. So any circumstances can be difficult, but how difficult the circumstance is or the situation is matters a lot in terms of how you bounce back. In other words, how you build resilience in terms of recovering from what you're going through. So for you then to be able to bounce back, to build your resilience, we need to look at the protective factors. And these are literally protect people, reducing the impact of hardship and difficulties. For example, in probably is this political situation we are talking about and your community is well fenced, that's a protective factor. Another thing, probably you have gone through such a situation before. So you have built some thick skin, so to say. That's a protective factor. Then the risk factors. These are those things or those factors that put people at risk, increasing the impact of hardship and difficulties. For another instance, especially for Kenyans, probably you can relate well. When it comes to post-election violence, if you live in a place that always have this particular, that is prone to violence after elections, then definitely that's a risk factor. So what do you do about it? You must find a way to change that risk factor into a protective factor. Then what do you do, or rather, how do you support yourself or support others when you're facing all these difficult circumstances? Again, Mike put it well. He gave examples of exercise. He gave examples of taking time out or, going for leave, talking to people, calling counselors, and all those other ways of responding to difficult circumstances. But in this picture, what now we do as the Red Cross globally, we do have opportunities of taking through young people, old people, all the walks of life, taking them through whenever they go through such a situation, such a hard or difficult situation. In this picture, I think this is Kenya. You'll find a lady there with the Red Cross emblem. So what she's doing, she's taking through these young people, or rather they're telling her what they're going through, and she's actually airing out or giving them some ways of coping with whatever they're going through. So in short, the lady is coping and assisting this particular affected population. So for you to be able to build the resilience of a community, then definitely as a person, you must have built your own personal resilience. And when we say personal resilience qualities, this is the ability to make realistic plans and carry them out. I'm sure you had planned to join this meeting for this webinar for various reasons. Probably you just wanted to, you have some 2 hours free, you want to join and be with us, or you really want to see what are these organizations doing to build the resilience, or what can I learn really from this. So the ability for you to plan to get this meeting then definitely shows you have some personal resilience qualities. Another one is having a positive image of oneself, self-esteem, so to say, feeling self-confident, having the ability to adapt easily to new situations, what we said, bouncing back, being able to deal with strong emotions, being able to communicate feelings. Remember we said, for a community to be a community, there is that interrelationship between feelings or psychological aspect and the traditional cultural aspect. So you being able to air out your emotions or feeling is a personal quality or personal resilience quality. Believing that change can happen. This is having a hope for the future. So as we assist others, as we give others support and also probably assist ourselves, we need to clarify the problem and provide relevant practical information. Again, taking you back to the scenario that we're using here, post-election violence, so to say, as you take me through, probably I'm affected. Have you take me through, please make sure you clarify the issue that I'm going through. I was looking at another example where it was the house has gone into flames. Then this person came in to help and he's trying to dwell on the house burning. But this particular affected person was not crying because of the house, going into flames, but she was crying because in that particular house, there was a relative. So this person is not suffering from losing the house, but the relative in that particular incident. So you need to clarify so that you can be actually helping this person because of the issue they are suffering, not just because you assume whatever they are going through is what you can see. So clarity is really important. Of course, support young people or old people to identify possible solutions. Deal with the here and now. If you find me in a house that is burning, the here and now there would be take me out of this house. Then build my resilience to deal with what is happening and bounce back to having a house or somewhere to live. So dealing with here and now is very important. Of course, accompany, support, and coach this person. You may be able to do it yourself, but we always say that you need to refer where you can't be able to support. Of course, we can't do everything. So you need to reevaluate yourself and see, what can I really do? Do I need to refer, or do I need to continue supporting because I have that ability? And lastly, provide PFA. Most counselors here, most psychologists here will know what is PFA. And in this case, is not please find attached. It's psychological first aid. Psychological first aid is the first help you give a person who is affected or rather going through a distress. If you have a cut on your hand or leg, the first thing you do is arrest the bleeding. Now, when you talk of mental health, the first thing you do is arrest the mental bleeding. Help this person to be calm and be able to at least express whatever they're going through. So finally, I'll just show a few pictures of what has been done by the Federation or the IFRC. This picture is in Sudan. These very beautiful faces of these young girls, they are refugees from South Sudan who ran to Sudan. And so what we did, of course, as you can imagine, they must be going through so many challenges. They don't have a home somewhere in school. They're now living in tents. They're not going to school. But we took them, trained them in life skills, gave them some skills that they can actually start businesses and here and there. And of course, have fun through sports. So that's a way of building their resilience. And if you go back there, you'll find that they do have a livelihood now, just because we started changing their mental picture of how they value life into a different life where at least they can feel dignified. Same case to here. This is also in Sudan. We did the same for these young people. So there are so many ways that we can actually assist others and build resilience for them, but please remember it starts with you. How are you psychologically? Then if you're not fit, definitely you cannot be able to support others. And finally, as we conclude, as IFRC, we do have a section or a branch of us who basically with mental health and psychosocial support, and we call them the IFRC Reference Center for Psychosocial Support. The headquarters is Denmark, Copenhagen. And what we normally do is support all the countries globally in terms of coming up with mental health policies, in terms of coming up with PSS projects, in terms of implementing PSS or psychosocial support projects, and building the resilience of the communities. We have so many materials that you can find by following some of this link, or you can actually email me directly and we can discuss on how we can support you further. Below there, you'll see hotlines. We do also support national societies, or rather the Red Cross and Red Crescent of different societies to different countries to support you directly by probably online counseling, or maybe you need to talk to someone. And of course, I know they will be shared on the chat if you want to follow up. But for now, I leave it there, hoping to hear from you, and please ask as many questions as possible. Back to Shivangi. Thank you.
Thank you, Basilio. That was really very nice presentation, deeping dive through different examples in what psychosocial support means. There's lots of learning for me personally. You also touched upon the key points in how do you assist people, and the concept of here and now was very important in terms of when we look at Sendai Frame and when we speak about build back better. And we often, when we start talking about build back better, it is mostly around building infrastructures and see that, if the infrastructures are more resilient. But here we are talking about, build back better of our mental health and capacities to cope up with the future disasters. So thank you for that. And as we continue further, this is Q&A session, and let me start on behalf of Mohin, the first question this is towards Mike. The question is, how practical is community resilience, putting in mind the aspect of individual resilience building? Over to you, Mike, for your reflections.
Can you come again with the question?
The question is, how practical is community resilience, putting in mind the aspect of individual resilience building?
Okay, I think it is actually very practical, and that is why we are really focusing on the individual, because any intervention starts from the individual, and especially looking at mental health. Mental health, I am aware of my own mental health, and you are aware of your own mental health. So there is no way I can come to you unless now there is behavior that shows that you are actually in a bad mental health state. That's the only time that I can be able maybe to make an inference and assume that maybe you need help. So it really starts from the self. So the practicality of it is actually very much in terms of investing in empowering the person, and especially the family unit at the family level, because that is where most of the learnings are being done. Children learn from the family, they model from the parents, and they're growing up. So that will be their behavior growing up. So if we invest in having interventions that focus on the self, and especially at the very early levels, and focusing on the community units, and that is the family unit, which is the most smallest unit of the community, then we are able to build resilience of a whole community based on starting it at that initial level, so that as a person grows up, they grow up understanding their mental health, and with that, they will actually be part of a resilient community. Thank you.
Yeah, thank you, Mike. And I'll go to Basilio. I did see him responding to Austin. The question here was, and for the for knowledge sharing with other participants as well. Basilio, if the question from Austin was that psychological first aid was sure is the key, but does it take the concept of lives?
Yes, I responded to Austin, and definitely, as I said in the chat, it is a holistic approach of the mental and psychological well-being. Just like the example I gave, if you are arresting the bleeding because I have a cut, then definitely you're saving my life. So in that sense, then you have to arrest my psychological bleeding if you really want to help me. But point to note here is that psychological first aid is not counseling. You are not taking me through the counseling process. You are just helping me here and now. Then you refer me to a person who will do the actual counseling.
Yeah, thank you, Basilio. Again, a question for me on behalf of Julia. She says, thank you, Mike, for taking us through the initial part of the conversation. You have spoken of what we can do for self and also towards the community in order to ensure mental health support is offered as we aim to have resilient communities. The question here is, what can we do within the structures of our own organizations internally to support staff mental health? A very important question, because I have seen especially organizations doing humanitarian response, somewhere the staff is also affected mentally. So question to you, Mike.
Thank you for that question. And I know, of course, Basilio will also help me answering that question because it's part of the building of the resilience, especially in the organization. But I also like that question because that question, basically, if I can translate it, I will just ask it as, is there care for the caregiver? That is the question. So most of the time we find that we persons who work for the community, we really focus on the community and we sometimes forget about ourselves. And that is why you find that most organizations for a long time did not have any plan, especially to take care of the mental health of their staff. We really focused on addressing the issues in the community and helping our communities. So the question is, what can we do in our individual organization? So I would start by, it has to start from the top. That is the decision-making level, whereby we have to make a deliberate effort to look into the mental health of the employees. Because number one, if the employees are not in a good mental state, then even productivity will go down. There's a study, the studies towards that have been done in terms of understanding productivity and the mental health of the staff. And you can see a direct correlation in terms of if the staff have good mental health, then their productivity also goes up and is actually cannot even be sustained at a very high level. But if the opposite is true, that they are in poor mental health, then the productivity also come down. So one, we have to have that decision from the decision-making table from the top. Number two, we really need to make deliberate effort also as individuals, as staff in the organization, to take care of our own mental health. That is why now, that is where the self comes in. Even as you're working, you need to know when you need to take a break, because burnout is real and burnout can affect you. And we can see some people even suffering secondary trauma, that is being exposed to traumatic events that they also affect you. And you find that people even go into depression because of the suffering that they have seen their community go through. So there is need also for the self to put his or her own mental health as a priority, and ensure that in the organization, you also know when to take a break, and you also know when you're overwhelmed and when to do a referral. That is when you cannot be able to handle a case, just make sure that you refer so that someone else can be able to handle it. Coming back to the organization, we can have welfare departments which look into the welfare of the staff and also their mental health. And this is very important in terms of offering debriefing sessions for the staff, also offering recreational kind of activities for the staff, just to go out and vent. That is what we call team building, but oftenly we do it only once a year, and sometimes it comes a little bit too late at the end of the year. But we actually have to inculcate a culture whereby we even have time, let's say once a month, just to have time as staff to go out and just enjoy ourselves, have some fun, have some exercise, and also just talk about the challenges that we face in the workplace and how to go about even addressing some of them. Another way that I've seen work in terms of other organizations, like even my organization, we used to have what we call continuous medical education sessions. And in some of these, we used to have them as expressive therapy. That is where we would bring a very big speaker and blast some music in the office, and everyone comes early in the morning with attires that are suitable for dancing, and then we dance early in the morning, and then we have a venting session, and then we go back to work. You wouldn't even know that it happened if you come back in the other hours of work hours. So there are so many things you can be able to do, and there's also literature out there that you can be able to study just to see which methods have actually been studied and have been proven to work more effectively than others, and maybe employ them even in the workplaces. Sorry for speaking a lot, but I'm passionate about this. Thank you.
Thank you, Mike. And I think I definitely like your solution of dancing before going to work. It's really really motivating. Thank you for that. With this, I'm opening the floor and would request Mr. Edward Chaka to kind of present his question, please. Thank you. You are on mute, Mr. Edward. Yeah.
Okay. Thank you very much for a wonderful presentation. I really like this type of presentation. This is very, very important. I know what it means. My question is simple: is what are the resources which are required to build some capacity of mental health in our staffs? But now part of it, I think he has, answered when he was talking about music, taking staff out. But now in terms of like some of our organizations who are under-resourced, how do we manage to get our staff outside the office, get them outside maybe for a lake view, something like that? I think that's what I wanted to hear more from you. When you're under-resourced, when you don't have maybe enough resources, how do you manage the capacity of mental health? Thank you.
Mike or Basilio, would you like to take this?
Yeah, let me jump in. Thank you, Edward, for that question. And I like the fact that you started by airing out the challenge, being under-resourced. indeed, that's a challenge that most of organizations have. Probably they are not even able to buy those speakers to, to have that music before working. But again, there are so many other aspects, and one of them Mike mentioned, like taking a break from work if you really feel like burnout. Because if I use an example, for those of us who have families, you cannot really feed your children from an empty sufuria, right? That plate must have something. And by that plate, I mean your mind. You must have something for you to be able to support others, caring for caregivers. So some of the materials and resources that we have are actually in our website that I already shared. I will post it in the chat. You can find practical things that you can do, whether on your own or as an organization, that will cost not zero, but probably very minimal resources that you need to do that. For instance, calling your staff outside, probably from the office, sitting down for 20 minutes and discussing the main challenges, that's part of caring for yourself, all right? Choosing one Saturday, going to work and just not working, but just talking of personal issues on what you're going through, that's caring for oneself. So go up to that page, look out some of the activities, reach out to me, and we will narrow down to what really suits your environment. And just to add, because I've seen comment on PFA, psychological first aid, I like putting it in three words. Look, listen, link. By looking, you are looking what is around you, who is going through challenges. Will I be able to help this person? Will I put myself in more trouble if I help? You are looking. Then listen, hear out this person. This listening can be verbally as you hear this person talk, or as you observe, as you look. That's part of listening, the facial expressions and what is happening. Then link. Linking is when now you feel you have offered what you could. Your plate had just enough and you have given it out. So refer this person to another person who has another plate, probably with a salad or something, just to make sure that this person is fully supported.
Yeah, and then maybe just to add also, I would just add on top of what Basilio has mentioned, that also sometimes it's also good to network. Why am I saying this? You find that there are some counseling psychologists who actually offer pro bono services. And if they offer these pro bono services, then you can be able to take advantage of that and bring that that trained person to be able to come in and talk to your staff and just help them in terms of their mental health. And as Basilio mentioned, some of these things do not really require much resources. They just need you to even allocate a few, some little resources just to be able to ensure that they are actually done. Another one that I would just recommend that I see working mostly, and I think we put this aside for the NDA parties, is actually the aspect of having a secret angel. And sometimes you can play that game, you can look and you can learn about it. And sometimes it doesn't have to be much. It has to be just to come from the heart. And staff can also just show that they care about each other in terms of having a secret angel, someone who looks after you while in the organization and just makes your life a little bit easier in your workstation, just to be able to take care also of your mental health. So there are very many ways. And I think there's also a lot of literature out there that you can be able to take advantage of to be able to ensure that you are actually doing something that is very cost effective for yourself and actually in terms of in line with your budget, feasible for you. And then again, I would encourage that in your workstations, you can be able to take advantage of the WHO quality rights. It's a training that is online that can be able to build your capacity in terms of understanding mental health so that you can know what are the little things that you can be able also to do for yourself and for your community as you continue in that journey of trying to build resilient communities and looking after our mental health. Thank you.
Yeah, thank you, Mike and Basilio. And I would request both of you to put your email IDs on the chat box so that the participants can get in touch with you directly for other reflections and other learnings. Is there any other question? I think there are no questions, but then let me take this opportunity to kind of thank both Basilio.
There's a question from Robert.
Yeah, Robert, sorry, please, Robert.
Thank you for giving me this chance, but I would like to congratulate former principal speaker that currently we have been affected by mental health challenge, but in a developing country, we don't know what are the source of such event and how to monitor and to use psychosocial as a media for get a cure. So how to make a community and a community at large to participate effectively, to understand the importance of psychosocial as a source of cure to the community. But also, we have been looking for different projects in developing countries like USA and others, but also in Kenya, that they are trying to educate the community in schools, family, and hospital. But in Tanzania, it is too less like that. So how can we cooperate and make a collaboration from Tanzania and Kenya or other outsiders to make a project for empowering the youth and young generation in mental health issues so that they can participate effectively? But the second issue, we have been looking that most of young generation environment in terms of environment, they don't have different idea on how they can cope with the situation, specific for people with different disabilities. So as human rights defenders and human or as a psychologist, how can we empower people with different disabilities in their community?
Basilio, would you like to respond to that?
Yeah, let me jump in. If I got you right, Robert, you are calling from Tanzania, right?
I'm coming from Tanzania.
Very good. I think the first thing, and I think I echoed this, and Mike did the same, it's about network. Are you aware of what is around you? Are you aware of which organizations that are surrounding you that can actually be doing what you are facing, or can actually support to actualize the ideas that you have? And to my best of knowledge, Tanzania, we do, especially the Tanzania Red Cross, I have seen some members here. We do have awareness sessions on psychological first aid, on psychosocial support, and of course on mental health. And recently, I think a few weeks ago, I was there and we did a very good training in terms of community-based psychosocial support. So basically, maybe my response to your question is, first, please like do an assessment. Who is there? Who is around you? Who is doing what? How can they actually see what is happening in my community? Because I totally agree with you. Probably they have not reached to your area. I mean, Tanzania is big, Kenya is big, a country is a big unit. But the first step would be trying to reach out internally. What do I have? Who can support me and who is doing what I'm thinking of? And from there, then you can be able to soldier on. Yeah, sorry, I can see you have an interjection.
Yes, you know, the reason behind to say that is that most of NGOs and other donors are trying to face in town and not in village. But when you go back to the situation, we know that in a village there is high number of people who are living there, but they don't have such idea. So in order to reach there, it is cost the first thing, but also that people who are in such community, they don't have, they are not aware on such thing about mental health. And you have told that in Red Cross, I'm a member of Red Cross, but we are trying to our level best in during the effect, maybe if there is a flood or there is some accident, it is where Red Cross, they do operate. But when you talk about how to finance a project, I was not aware that even Red Cross, they can be the sponsor of such issue. But also we have those people who are in hospital, but operating in different categories in mental health issues, psychiatrics and others. But if you take an opinion or a project, they tell you that they don't have money to fund such project. So I was asking that where to start in order to operate in villages and to start to make intervention, error intervention in schools and hospital, in even family level.
Very good.
Thank you, Mr. Robert, for that intervention. And let's move forward. We are now coming to a very the last bit, and there's still urge, and I see some of the chat comments, and I completely agree. It's a very interesting session, honestly, and thank you, speakers, for that. But there's still little urge to learn more. So as a part of your closing remark, I will start with Mike. Mike, I have a question for you, that we are living in a world where there is COVID, where there is maybe conflict, where there is drought, and all together, and not in this part of the world, but also from where I come. How do you propose to engage the youth organization in building resilience of the communities to address these issues of mental health?
Thank you very much, Shivangi, for that question. And I think it is prime time that we youth really stand up and come out strongly to be able to claim our spaces. So in terms of engaging the youth, you find that maybe the previous method of engaging the youth are really not working at the moment. Because like even just taking a case example of where we come from here in Kenya, sometimes when you want to mobilize the youth and you go maybe the traditional methods of maybe going to a radio station and trying to mobilize them to give out information that the youth should turn up for certain events or participate in a certain activity, then you find that that does not really reach most of them. You find that most youth are normally found in the social media. That is the aspect of technology. So there is need to embrace the new elements of technology in order to effectively reach the youth. And so you find that even the content that is being developed that is targeting the youth should be content that they can actually relate with. And that just brings me to the mantra of UHC of nothing for us without us. And sorry, not for UHC, for any disability, for the disability movement, nothing for us without us. And looking at that is meaning that we also have to include the youth in terms of planning. When we are designing the intervention that we intend to reach them, then we need to have them on board because they are the only ones who understand what works for them. So if we exclude them from the planning phase and we expect them to come at the execution phase, then we have already planned to fail. And that is mostly where we get it wrong. So there is need to include the youth when we are coming up with this intervention so that they can bring in their minds, they bring in their ideas that can actually resonate with other youth. And in this way, we can be able to reach them and be able to help them to meaningfully engage with what we are trying to do for them so that we can be able to improve, one, their quality of life. Two, we can also be able to minimize the aspect of them being radicalized or being prone to violent extremism, and also bring in the aspect of building their resilience, especially in terms of taking care of their mental health, because you find that at the youthful stage is where most of the mental health conditions actually manifest or actually come out and show themselves. So at this level, if you can be able to address them and even target them directly and include them also in all the decision making, then we are able to reach them at a very prime age and be able to have intervention that will build a resilient community in the long run. Thank you.
Yeah, thank you. Very important. Youth as a capital can be mobilized, especially for mental health and psychosocial support. And they themselves would kind of, transition process. So really very pertinent. And apologies for background noise. I don't know where this is coming from. But Basilio, let me also take this opportunity to grab some of your reflections and learning. What do you see as an opportunity between the mental health actors and humanitarian and development actors when it comes to the application of resilience thinking?
Yeah, Thank you for that question. I think Mike touched on it as he was covering the earlier question. And I think that the main point here is to do something I like calling mainstreaming of mental health and psychosocial support in all the responses that we do. I'll give an example. If you're suffering from drought, lack of food, and I'm coming to you to bring you food, if I give you food, here is the food. Or, hi, how are you doing? Sorry for what happened. Here is some support that we have in form of food. Those two scenarios are, the goal is to give the food, but the first one sounds like if you eat, you're fine, but you're not. Psychologically, you're affected by what is happening. So really, if we can struggle, we can do as much as possible to mainstream the mental health part of it in everything we do in humanitarian setup, then definitely we will be actually covering the mental part of it, the mental health part of it of this particular affected population as we offer the practical help. And this is something that we've been really trying to do as Red Cross, to make sure that in every response we have, whether drought, floods, in whichever country we have, there's a mental health personnel accompanying this particular disaster responders, that they do that. And I've seen someone who is studying disaster management. So probably it's a high point to make sure that even in colleges, we introduce this mental health as a compulsory course. I mean, the introduction to mental health and psychosocial support. And by doing so, then we'll be able to cover actually most of what is disturbing most people, I mean, in the communities. Because how you think of something or how you perceive something really matters and really dictates how you bounce back or how you build resilience from whichever situation you're going through. And Shivangi, is interesting to see that we are coming from different angles, different communities, and we are discussing the same issue, meaning it doesn't matter where you live in, what community you are in, the issue is the same, mental health. And building resilience, the angles, the structures almost remain the same. So it's up to us as humanitarian organization or even any other organization to make sure that they mainstream, or they make sure that in every response or in everything they do, then mental health is part of it.
Very, very important, to take into consideration mental health support, not as a cross-cutting, I would say, a topic, but definitely kind of focusing it while you are doing needs assessment, for example, for humanitarian or DRR purposes, and to understand the mental health. And I have worked in some of the dense peripheral areas, in urban areas where youth really struggle with this kind of problems a lot. There's one question from Margaret to you, Basilio. It's related to, do you have volunteers, counselors in Red Cross? If you would like to quickly respond on that.
Yes, we do. In actually all the countries we support, about 196, we do have volunteers, counselors who are, yes, counselors by profession, but they are volunteers. So you can reach out to, I don't know which country you're calling from, but you can tell me and I'll definitely direct you to the right person to talk to. But in the meantime, I have posted a few. If the country you come from is not listed there, please let me know and we will definitely connect you.
And we have very young person, David, doing disaster management and humanitarian assistance with peace and conflict studies at Messinade Miliro University of Science and Technology. And as a youth, he finds this topic really, really, really amazing. And we hope, David, that you will think about it. How do you integrate in the studies that you are doing? Thank you for your comment there.
Yes.
I would now request, we have come to end of this, webinar, and I really wish that we could go on and on. It's such an interesting topic, and there is so much of interest in the topic. However, we are constrained with the time today. But thank you all for your participation, and I will request Pauline to now take the floor for her final comments. Thank you.
Thank you so much, Shivangi. Thank you, Mike. Thank you, Basilio. It was a pleasure having all of you attend this webinar, and I believe you've picked one or two things, and I'm sure you've really learned something, if not new. You've really built on what you already know in matters psychosocial support and mental health. Yes, and just to appreciate you for creating time. Those that we were not able to really respond to their questions, we really apologize for the time. Robert, feel free to reach out to Basilio. He's shared his contacts and my contacts too. All the presentations will be shared to all of you. If you need a follow-up, if you need some more clarifications, we are here. Don't feel left out here. Don't feel like we didn't give you the time. The time was very limited, but we are always ready to answer to any of these questions. And we have our panelists here who are well experienced in this issue. So feel free to reach out. Yes. So mine is just to appreciate you and to ask you to please put on your cameras as our communications person, Joy, takes the photo for reporting purposes, and to inform you that we'll be having more webinars coming. And as we share the information through your emails, then you could suggest the topics you'd like to discuss on in the coming webinars. We have various activities lined up. So once you sign to be a member of Kenya for Resilience, you'll always get the updates. We have a Science Cafe, we have exposure visits and all that. So we will always update you. So kindly put on your cameras so that Joy can take a picture. And she's saying that please smile from wherever you are. Are we ready, Joy?
Have some unhappy faces. Wouldn't look nice in the picture. Okay. Great. Solomon, I see the smile. Gershom, I don't see a smile. Oh, we have some people who are not very excited. Okay. Stephanie, Sylvester, Bisonge. Just one more. Thank you. Over to you, Pauline.
Thank you, Joy, and thank you all. So have a blessed evening, night from wherever you are, and we meet in the next activity. Bye-bye.
Thank you all.
Bye. Thank you so much.
Bye-bye. Thank you.
Thank you and bye.
Bye-bye.
Bye.
Bye.